Islamic microfinance is becoming an increasingly popular mechanism for poverty alleviation, especially for developing countries around the world. This microfinance service adheres to the principles of Islam as a form of social responsibility. Yona Islamic Microfinance is the Islamic microfinance of choice in the Gambia, trustworthy and reliable. At Yona Islamic Microfinance, we provide savings products, current accounts, financing products in conformity with Islam. In addition, Yona Islamic Microfinance also offers local and international remittances, takaful fund, management of zakat, management of awqaf, trading and investment, and building of strategic partnerships to bring financial services to the doorstep of the poor with donor projects, madrasas, youth organizations, women groups, and farmer organizations. Make a choice with Yona Islamic Microfinance today. For more information on Yona Islamic Microfinance, call 377-2151 or 9832-151 or visit Yona head office at Tipa Garage, Bakote, or visit any Yona branch located countrywide near you.
anniversary, and that means this program has been on and been successful for 3 years. And the good part about it is the sustainability, because sometimes we start something and instead of expanding on it and making it grow, it dies out because people are not interested. But this work for health has been on. I was here in the second anniversary and came once after that, and I've never appeared again. But it's good that people have been able to be coming all the time, and it has been on, and it has even expanded to the regions. Of talking with some people here from North Bank and those from West Coast, and they tell me how they've been doing it twice a week, once every week, which is encouraging, because we all know that unfortunately people here are not very keen about exercise, and it's one thing that is very good, because we all go to the hospital for some reason when we are sick, but exercise serves as a preventive health system. So instead of waiting until you get sick, it's better to start exercising, because then you're able to avoid some of these communicable diseases and some of these minor illnesses that we all have. And that is what we want to encourage everyone here. It's difficult, we know. Sometimes we're all busy at work with family and other duties that we have. But occasionally, it's good to join groups like this, because you can do that by yourself at home, but with a group, you kind of have the encouragement. So I want to do a personal commitment that I'll be coming more frequently. It's apart from today, so it wouldn't be like last year when I came only once and that was it. So you'll eventually be able to see me more frequently, but I want to encourage all of you here to do that. But also, let's bring our partners along, let's bring our family members along, because that is what is good. Yes, like I did, exactly. But on that note, I just want to thank everyone that has been part of this process. I want to thank the sponsors and everyone that has supported. But those of you that come, please keep coming, and I'm sure we'll be able to encourage more people to come. Those of us in government circles, bring our friends in the government, so that we all be able to get healthy and remain healthy for a long time. So not to take much of your time, I just want to say thank you. And Honorable, thank you very much for all this time.
Mr. Baji and his department has already started contacts with Work for Health to see how we partner into taking the fight to the communities against non-communicable diseases, particularly as it relates to one of those factors, inactivity, to fight against inactivity, which is one of the causes towards non-communicable disease acquisition. Mr. Baji, you're welcome.
Activity is a great concern in the Gambia, because we are seeing an increase in non-communicable diseases. When I say non-communicable diseases, these are diseases that are not transmitted by any pathogen. They are lifestyle diseases, and they are on the increase because people are not doing physical exercise, because people are using tobacco, because people are drinking alcohol and unhealthy diet. But environmental pollution. But today we are here on exercise, which is part of the physical activity. So all my statement or whatever I'm going to say will only be limited to physical inactivity. In the Gambia, physical inactivity stand at 22%, meaning 22% of the Gambian population, especially the adults, are physically inactive. What this means is that we are gradually developing a condition that is leading to our death slowly, because whatever we eat, especially fatty foods, oily food, sugary foods, they all accumulate in the body, and we need to do exercise to ensure that we lose those calories. How can we do this? Is the exercise. But it's unfortunate that in the Gambia, you see from one Johnson to another Johnson, people will take taxi, especially among the women. This is why we have seen this is why we are seeing a lot of NCDs. If you go to Edward Francis Small Teaching Hospital, which is capacitated to manage NCDs, non-communicable diseases, every Monday, every Wednesday, they have clinic for diabetes and the clinic for hypertension. Every Monday and every Wednesday, they do register 4 to 5 new patients, meaning they are first contact at the health facility. And the majority of those people are women. Yes, majority of those are women. And we have to take seriously our physical activity to to stem down the prevalence of non-communicable diseases. And at the Ministry of Health, we are doing all our best to ensure that physical activity being promoted, and that we like this initiative. Just recently, we developed a physical activity strategy, which we invited Work for Health to be part of this development of the physical activity, to ensure that we have collectively developed strategies, we put heads together so that this Work for Health that is being initiated by you people to be replicated in all the regions. This is our, and we are calling on all partners to join Work for Health so that we can have a healthy population in the Gambia. As I said earlier on, imagine 34% of all deaths, I repeat, 34% of all deaths in the Gambia are NCD related. 34% of all deaths in the Gambia are NCD related. And we are seeing serious complications in terms of hypertension and diabetes. These non-communicable diseases, they are lifelong diseases. Once you have these diseases, there is no cure. Conventional medicine, there is no cure for these diseases. But it doesn't mean that when you have these diseases, you will not live normal life. You will live normal life if you are practicing physical activity, you are mindful of your diet, you don't smoke, you avoid alcohol. You will live normal life as if you don't have the condition. But these are the problems that we are facing. And once you have it, it's lifelong treatment. You will only be cured. You will only be cured when you answer to the call of the Almighty God. Of NCD. So to avoid that, we should all do physical exercise. It's free of charge. You can do it anywhere you are. Anywhere you are. Even in your own house, you can do. WHO recommends 45 minutes per day. 45 minutes per day, brisk walking. Your normal way of walking is enough. And you can do it even in your compound here, your house. You can jump, you can sing, you can dance. So it's not costly at all. It doesn't mean that if you don't go to the gym, you are not doing physical activity. This is the notion that people have. You put on very good gears. Yes, you put on very good gear. If you don't have those gears, meaning you will not do physical activity. But your normal dress, you can put your normal dress very neatly and do your exercise at home. And we are so happy, so proud to be associated with this. Our minister or the permanent secretary himself want to come, but unfortunately is so busy with other official air, and this is why they could not make it up. And they assigned us to come. I'm here with my team. My assistant is also here, and my boss, Mr. Gassama, is also here. So we are so proud, we are so happy, and we will always support this initiative so that it can be replicated in all the regions in the Gambia, and for us to have a healthier life, and we cut down the prevalence of non-communicable disease in the Gambia. Thank you very much.
I honestly, I have to thank Work for Health. From the bottom of our hearts, the World Health Organization is very much aware of this initiative.
Thank you.
From the word go, we know, the Ministry of Health has alerted us, and at the same time, Sheriff has been, working with, closely with us as an organization, and we are aware that you are doing something very important. Of course, what Baji has said, unfortunately, I don't know whether, the women are going to beat the science, but the science that we have is men are more active than women globally. So maybe the Gambia can try and change this equation. There are many factors, but you can do it. And I think the Gambia is going to change the science.
We have changed.
And I think you have changed the science. I was told that somebody at the age of 64 is around us. Look at it. It's like a young girl, So you have a story to tell. And this is exactly where we are. Mr. Sangor Gomez, you have set an example. We are going to rally behind you and the Minister of Health to make sure that this is a national issue.
Thank you.
It becomes a national event. Because as he said, nearly 3 million people die every year as a result of being physically inactive. It costs lives. And the world loses over billions, over $15 billion every year as a result of physical activity, inactivity. So you can see it's a burden on our economics, it's a burden on our health, it's a burden on our social activities. So on that note, all I can say here is to thank you very much. Your third anniversary is excellent. It's an excellent demonstration for the whole country, and I hope you will really we will all work together as a UN
Stakeholders.
and all stakeholders to champion this. This has to be everywhere. This has to be our routine. So we thank you very much, Sheriff and the team, for this excellence. So on that note, we thank you. God bless you.
Trust Bank is a Gambian bank. We are Gambian owned and Gambian managed.
Yes.
My team is right here, all very young, energetic Gambians. Yes. During Trust Bank's time, we were looking at the numbers the other day. We have donated over $50 million. And most of that is to the health sector. But I think it would make better sense to redirect it to keeping people healthy than to wait for people to be sick and then we go and donate to the hospitals. That is the reason why we are here today.
Country director, go for the millions.
Yeah, for the millions.
I joined Work for Health in October 2019. When I joined Work for Health, I was a diabetic. Well, I am a diabetic, but I was on medication, different kinds of medication. But when I joined Work for Health, it is the only exercise that I have been able to sustain. Not only am I off medication right now, but I am as fit as the young ones. Fitter. 2 weeks ago, we walked 15 kilometers. Sometimes we walk from here to Banjul and back 21 kilometers. We can do it. I did not like the statistics about women that I heard. We need to up our activity level. Before you stay home and cook and take care of the family, you have to be well, you have to be fit and alive. Understand? Yeah? You can do your exercise, then go back home and still take care of the family. So I am encouraging all women to come out and exercise and keep themselves fit and healthy. We want people to be alive so that we can continue to bank them and collect their money. But when we collect their money, we put it back into society. Trust Bank cares about Gambians. Gambian lives matter to us. And that is why wherever we see a need, whether it is in health, in education, in sports, I'm sure you see us on GRTS sometimes. We are all over the place in all communities trying to see in what way we can bring meaningful development to Gambians. Yeah. So we want to encourage you to keep partnering with us. We will give it back to you in one way or another so that we all benefit. Thank you.
Finally, we thank from the bottom of our heart the Gambia Trust Bank Limited, proudly Gambian and proudly sponsored this Work for Health this year. We thank you, Madam MD. We thank you and your staff for doing this. We know you didn't do this because you were here. You did this because you believe in walking, in exercise, in fitness. And like I said before, investing in community health is a wise banking investment because it is people who will come and bank with you. If they don't come, your bank will not work.
If they are not healthy, they will not bank.
Exactly. On that note, let me also thank Gambega for staying with us, sticking with us all the time. We thank Gambega from the bottom of our heart. John, thank you very much. We appreciate this. We thank every Work for Health members, everybody who had attended here today. You, the media fraternity, we thank you from the bottom of our heart. You have always been with us, and let us continue to do this. We owe this to the community, to the societies.
waaw love love like fire xam ngeen rek affaire bi xam ngeen fan la skincare la 2020 lañ wax de waaw fii nag mooy Kerr fan Kerr zero tache perfect skincare saa su ne rek niñ ko dee defee rek loo lañ soxlaati rek maanaam bu ngeen am problème ci seen skin yéen xam ngeen fan la fii ngeen di ñëw suma xarit yeeg am di jàmm yi nga xam ne taas daf lañ sonaloon xam nga doon xeesal ba laka xum éneew ma lañ ko nag waaye just in case comme ni ko gars yi di waxee rek en cas just in case loolu xew xam ngeen fi ngeen di ñëw skincare plus si yu baax rek la ñoo dox nag ay baax rek fu ne la ñoo dem ci réew mi di lañ indi rek nag products yu baax du Paris du Italie du USA du fi mu nekk nii sax boole nañ ci nag Sweden fu nekk lañ leen a indilee products bu dee tamit nag da nga ñuul rek ñu lay jamaa natural beauty that melanin dripping we do have stuff for you as well emuñ si skincare products rek ñu ngi ci cuub yi tamit fu ne la ñoo jaar in fact sax last commercial bi ñu defoon waxuñ leen woon ne dañoo dox ci ay kawar 9A grade rek nag waaw we do have bundles as well hair si lu ne la ñoo dox ñun ñu ngi ci rafetal jigéen rek luy taaral jigéen rek waaw boo leen di tukki tamit bëggoon rek classic suitcase ñu dañoo dox ci ay Samsonite duñ dee indi any brand of suitcases though other than Samsonite comme li ma dee wax rek boo eggee airport dëri Samsonite dafa am nuñ laa xoolee waaw ngeen lan nag waaw skin ci moom la ñu gën a xamee nag skin care products ci moom la ñu gën a xamee ñu ngi dox tamit benn tey tamit si ay dàlla waaye man nag skin care mooy suma specialty xam nga rek jigéen bu sa xar kanam réglé loo def mu jag am nañ Patricia Reiner Kiwi Eye the whole range Lighten Up Gold Tomatine I mean the list can just go on and on and on and on lépp loo xam ne rek luy taaral jigéen la ci yooyu rek la ñoo dox skin care plus nag emuñ si Gambia rek ñu nga United States ñu ngi Gambia fii ba pare bu dee yaa ngi anywhere in Europe mun nañ la ko mail within 3 days rek ñetti fan rek nga jot say diw emuñ si loolu rek dañ laa consult tamit balaa ñu laa jaay diw dinañ def a free consultation pour wax la rek exactly li nga xam ne moo méngoo ak sa kanam dinañ leen wax tamit ne rek am nañ perfumes fragrances men's shirts accessories we do dresses as well we do blouses we do shoes name it we do them Skincare Plus 2020 is our year of perfection zero task fi mu nekk nii réew mi fii kenn waratu fi task kenn waratu fi am problème kanam kenn waratu fi am problème yu picca boo ko amee dafa fekk ne rek ñëwuloo ci place bi fii love like fire bring my love like fire
Agada.
Mbijan aganyani.
Albaka.
Mbaka important.
Yo, nga transfer la sto.
Ya transfer la sto.
Ha, code nyingi.
Okay. Important. Nsila ID soto.
Sa soto. Sorry. Agada.
Mbijan bro.
Albaka.
Mbaka.
Bara alla service o tariaka.
Mbare.
Mo ki janna nun kunu bara tariaka.
Jannom yona forest de bureau. Gambia tonkon na no mbali ya bere. Birim koyna fo katon
bari si kodo kino katon nim fo bolong blabe
56 branches mola soto Gambia jam
ha
Gambia kono ani Gambia bantala bankol nka kodo kiya beleto kodo sifa fo falindiro fo nyaadi lafta même na kodi to poto nin kodi maraw jannom number 1 ti nyonta andum fana nata anoda enterprise sotale wolam nyindi ko domorol fana kol fana be firale le dadi ma ni domorol ni fana beteata Gambia dawda yalo ngam fa kendol sotale je
wo moyo diat
apelenta
baraka ba ya lafta nyelan kendol e bina
yalo bu kanila ko la baraka ba
yalo ndel ciosano lo
baraka
We live in a day and age where technology is creating a world without borders, filled with unlimited potential to improve the lives of the people around us. Innovarex Global Health ushers in a new way of leveling the playing field with increased access to quality healthcare services delivered at your doorstep. Our qualified professionals are equipped with state-of-the-art point-of-care testing technology to conduct tests such as kidney function, liver function, electrolyte tests, body composition, hemoglobin, A1C, and many more services with the highest efficiency in delivering results. The addition to our flagship Wellness on Wheels, more fondly known as WOW Delivery Service, brings the entire clinical experience full circle. IGH has remained committed to creating the future of healthcare delivery. Gone are the days of sending loved ones outside the country for basic medical services. Innovarex Global Health offers a new peace of mind and takes pride in delivering the quality of care we all deserve.